Hey guys, Justin Smith here from Hunter Podiatry Services, and I'm here to give you my top tip of the week. Today I've got Frankie the foot back again to help us out. We're talking about heel pain, what it is, why it's there. So, commonly referred to heel spurs, plantar fasciitis, bruised, sore foot, sore heel, gets called a lot of different things. The most specific term deemed for it now is heel pain syndrome. Syndrome meaning there's a few things coming together to cause an issue. Syndrome is a multitude of pathologies going on, and we know that there's a few things happening with the heel. So we've got the foot. This is obviously just showing the bones. Certainly we know that there is sometimes an element of bone bruising or bony edema going on. The plantar fascia, which is the band which runs under the inside, which often gets blamed. It is certainly involved, and it can get a little bit cranky and sore. Inflamed in the early stage, but also degenerate just a little bit and start to become a bit of a chronic structure going on. The fat pad that sits around the natural shock absorption can be involved. Certainly the nerves that run through the inside and the outside can get a bit sore, and some of the small intrinsic muscles that are inserted in and around there can all get sore. So certainly some bony structures and some soft tissue structures which all formulate this system in the back of the foot, can be involved in some way, formulating that syndrome type thing. So that's what it is. Why is it there? Certainly it's the first thing that hits the ground when you're walking, and so that means it gets loaded a lot. It's a resilient structure naturally, but when it's compromised, it's hard to get retrieval or rest for it to settle down. It's an extremity, so naturally blood supply and things like that means healing can be a bit of a thing that takes a bit more time. So there's some of the internal factors, but then the external factors, the out of your body factors that load this area of the foot. Surface areas, so in the modern world we walk on tiles, timber, concrete, a bunch of those things that are all hard and very durable and clean is why we probably evolved to them, but they're very hard on our feet, so hard surfaces can play a part. Certainly as well, some of the other things, footwear, slim, thin footwear which don't go very well with hard surfaces can play a part in not letting it settle down. So they're just a couple of factors as to why it's so common, very basic ones. There's a few other ones, big ones, that can contribute to overload in this area of the body, contributing mechanics and a whole host of other things, but we'll talk about those two things today. How you can go about settling it down. So often, a lot of the time, there's a big compressional force to it. So basically when you rock back on your heels or when your foot first hits the ground, it's like a bruise. I like to educate people around the whole area, the whole system has been overworked, it's sore, it's cranky. I like to talk about in the early stages, it needs to be unloaded. So it needs to settle down and calm down, and we need to plug in tools to try and give it a cuddle, basically. So figuring out how you can best give it a cuddle so that you can start to naturally let natural healing occur as best you can, before you then need to start plugging into treatments to try and boost the recovery. So that's a little bit about heel pain syndrome, what it is, why it's there. It is the common cold of foot complaints. We see it a lot. A few reasons, as I stated, as to why. Hard surfaces all the time. First thing it hits the ground, hard to get relative rest for. Start early as soon as you can with it. Try and wrestle the tide back so that it's not getting as compromised in the first place. It can be really useful. And be persistent and figure out the best way to try and get it settled as quickly as you can. So many things I could talk about with heel pain. We see it all day, every day. But get a plan together like usual, get it settled and go from there. Have the best weekend.